We're going to look at the splenic artery, which goes towards the left hemi-abdomen. So to establish position, the liver is right here, and we have the stomach, that was retracted superiorly right here. So that's the splenic artery right there. It is actually closely related to the body and tail of the pancreas. This is the dissected pancreas, the body and tail. So the splenic artery actually has branches that will provide blood going to the pancreas. And by the way, these structures are all retroperitoneal. So the parietal peritoneum in this area was removed before these structures were seen. So that's the fundus of the stomach up there, right there. Then this solid organ here, that is the spleen. The gastrosplenic ligament was partly dissected also here. So we can identify some of the branches of the splenic artery. Once again, this is the splenic artery going towards the hilum of the spleen. The spleen is part of the organs. It is one of the organs of the immune and lymphatic system, and we can also consider that part of the circulatory system. It is not actually an accessory organ to the GI tract, but due to its location and its close relationship with GI tract structures, we actually discuss the spleen partly here. So the splenic artery, once again, it goes towards the hilum of the spleen, and then there will be branches of the splenic artery going towards the stomach fundus, and that will be partly embedded in the gastrosplenic ligament. This bundle of vessels here would be the short gastric vessels, a short gastric artery and a short gastric vein going towards the fundus of the stomach. And then this bundle of vessels here would be the left gastroomental or left gastroepiploic vessels. The left gastroepiploic artery also comes from it's one of the branches of the splenic artery. So gastroomental or gastroepiploic left, it courses along the greater curvature, and it will actually form an anastomosis with the right gastroomental or right gastroepiploic artery, which is right here. So once again, that's the common hepatic artery right there. This one is the that one, that's the gastroduodenal artery, where the right gastroepiploic artery comes from. Can you see that one? That blood vessel right there, that's the right gastroomental or right gastroepiploic artery coming from the gastroduodenal artery. So the spleen is one of the organs that may sustain injury when there is trauma to the abdominal region or to the lower back. And since it is connected to the circulatory system and Actually, it serves as the organ for removal of dying or old red blood cells. Injury to the spleen can cause hemorrhage. No? So, when there is a splenic injury, splenectomy may be necessary to control the hemorrhage. And aside from the main splenic artery, we also need to ligate the left gastroepiploic vessels and the short gastric vessels, because if you cannot identify and ligate them properly, your hemorrhage can persist right after splenectomy, because